Welcome back. Today we're continuing our discussion on substance use disorders, focusing on alcohol, caffeine, cannabis, and hallucinogens. These substances may seem very different, but each carries important clinical and social consequences. Let's start with alcohol. Alcohol-related disorders are among the biggest global health issues. About 20% of men and 10% of women will meet criteria for alcohol use disorder in their lifetime. It shortens life expectancy by around 10 years and is tied to more than half of auto fatalities, 3/4 of evening accident deaths, and a striking number of suicides and homicides. Despite this, up to 80% of cases are missed in primary care. Why does alcohol dependence develop? Several factors contribute: childhood attention deficit, hyperactivity disorder, or conduct disorder, certain environments like dorms or the military, parental drinking behaviors, and of course genetics, with close relatives having a fourfold increased risk. Biologically, alcohol is absorbed mostly in the small intestine, metabolized in the liver at about 1 drink per hour. It increases GABA, acetylcholine, and serotonin while decreasing glutamate, which explains its sedative and euphoric effects. Women often reach higher blood alcohol levels than men because of body composition and slower metabolism. Clinically, a BAC of 0.4 to 0.5 can cause coma, and levels beyond that risk respiratory depression and death. Chronic use also raises the risk of liver disease, cancer, and heart problems. Alcohol intoxication is familiar: slurred speech, impaired judgment, aggression, poor coordination, and sometimes coma. Withdrawal, however, is much more dangerous. Symptoms begin within hours: tremors, sweating, rapid pulse, then progress to hallucinations, seizures, and in severe cases, delirium tremens, which involves confusion, vivid hallucinations, and life-threatening instability. Complications of heavy drinking include withdrawal seizures, Wernicke's encephalopathies, confusion, ataxia, and eye movement problems, and Korsakoff's syndrome, where people lose the ability to form new memories. For pregnant women, alcohol can cause fetal alcohol syndrome, with growth restriction, facial changes, and organ defects. Treatment usually starts with detoxification using benzodiazepines to prevent seizures. After that, long-term support is essential. Medications like Naltrexone reduce cravings. Acamprosate helps with withdrawal. Disulfiram causes unpleasant reactions if alcohol is consumed, and topiramate can reduce dopamine release. But medication alone isn't enough. Psychosocial interventions like CBT, motivational interviewing, 12-step programs, and family therapy are key. Now let's shift to caffeine. It's the most widely used psychoactive substance worldwide. About 85% of U.S. adults consume it daily, averaging 200 milligrams. At high doses, though, it can cause intoxication, restlessness, insomnia, rapid heartbeat, and agitation. Very high intake, like 10 grams, can even be fatal. Withdrawal is common: headaches, fatigue, irritability, and difficulty concentrating. The good news is it usually resolves within a week, and treatment can be as simple as tapering intake gradually. Next, cannabis. It's the most commonly used illicit drug worldwide, especially among young adults. Its active ingredient, THC, acts on cannabinoid receptors in brain regions like the hippocampus, cerebellum, and cortex. But interestingly, not the brainstem, which explains why cannabis doesn't usually suppress breathing the way opioids or alcohol do. Clinically, cannabis causes red eyes, dry mouth, rapid heartbeat, and increased appetite, the famous munchies. But long-term use carries risks like chronic bronchitis, impaired learning, and higher risk of psychosis, especially in men predisposed to schizophrenia. Withdrawal can include irritability, insomnia, restlessness, and decreased appetite lasting up to 2 weeks. Treatment is usually outpatient with supportive therapy and relapse prevention strategies. Finally, let's look at hallucinogens, specifically PCP. It's a dissociative anesthetic sometimes called angel dust. Though lifetime prevalence is low, about 2.5%, but intoxication can be severe. PCP blocks NMDA receptors and acts on dopamine neurons, producing agitation, impulsivity, hallucinations, and violent behavior. Physical signs include nystagmus, hypertension, numbness, rigidity, and seizures. There's no recognized withdrawal syndrome, but acute intoxication can be life-threatening. Treatment is supportive. Antipsychotics or benzodiazepines may help with agitation, and sometimes inpatient psychiatric care is needed after stabilization. So, to sum up, alcohol remains the most harmful, caffeine the most common, cannabis the most widely used illicit drug, and hallucinogens like PCP the most unpredictable. Each has its own pattern of intoxication, withdrawal, and long-term consequences. Understanding these helps clinicians not only treat the conditions, but also prevent tragedies linked to substance use. That wraps up part 2 of our series on substance use disorders. Thanks for listening, and remember, whether we're talking about alcohol, caffeine, cannabis, or hallucinogens, awareness and empathy are the keys to effective care. If this review helped simplify a difficult topic, consider subscribing for more high-yield medical education content, and let me know in the comments what topic you'd like covered next. Until next time, keep learning, keep growing, and keep expanding your horizons.